think did you make it available, Dr. Sherry?
Should be there.
To go get tissues.
These are my exemplars I put together to focus on seizures, meningitis, and all. Now, under your course curriculum, you have videos to see. Watch those videos. They're very informative. They've got a guy having a seizure, and it's kind of fascinating watching how he's laying in bed, and all of a sudden you can just see what goes on. First one is seizures. Seizures are an abnormal, sudden, excessive, uncontrolled electrical discharge of neurons within the brain that may result in a change in the level of consciousness, motor, or sensory ability and or behavior. In your book, chart 44.6 gives you a bunch of assessments and data for your seizures. One of the key things is I don't know if you guys have heard the term aura. Some people who are epileptic and have seizures, they sometimes will get double vision first, or they get flashing lights. People with migraines are familiar with auras. I get migraines, and I always get the flashing lights before that migraine kicks in. So I can pre-medicate myself prior to the full kick-in. The number and frequency. Why do you think that's important? That and type in characteristics for seizures. We need to know. We need to know the date and time it happened, how long it went on for. Are you having multiple a day, or is it just one time a day? And a lot of people are newly diagnosed. They'll start keeping record, so the doctors can figure, does it happen in the morning? Does it happen in the afternoon, night? What were you doing when it happened? What kind of seizure was it like? You know, was it just a mild one? Did you have a hand tremor, or did you lose complete consciousness? You know, full-blown, and that's where these two kind of go hand in hand. Medications. Medications, they will give them, and with medications, it's a hit and miss when you first start medications with seizure patients. They're going to try, and they'll end up titrating it a lot. Sometimes they'll have to go up, sometimes they'll have to come down on those medications. And diagnostic testing, and once again, you see the MRI, you see the CT, and you see the EEGs.
A lot of times around 6 they want to see the number and frequency to see if they're eligible to have a certain type of surgery.
Correct. That is. It is pretty interesting. Okay, medications. A great chart for medications, guys. Let's go look in your book on 44-3. They've got a whole list of the medications. They give them what they were for. They give side effects and how they're effective. Once again, you're going to see teaching. It's very important that you teach your patients their medications. You want them to continue their routine, and these medications have to be taken routinely. You want to teach them the side effects, that they know what's going on. You want to, like I said right here, initial dosing, trial and error, and monitor blood levels. What's one, let's say we have a medication, we used it in SimLab, the person was seeing yellow. It's a major side effect of a medication, digoxin. That's why you do blood levels. You want to see what the levels are in certain medications because they can become toxic to it, and then you have to adjust it. And then family education is also very important. So you've got both their education and the family education coordinated. Precautions with seizures. Protect from injury, especially the head. Never place anything in the mouth. Why is that? Choking, exactly. They used to put padded tongue blades. You've heard of that before. Not a good thing to do. Turn the patient on the side. Why? Aspiration precautions. Not saying they're going to throw up, but sometimes do it. Side rails up and may be padded. Most seizure patients will have padded side rails. That's for their protection. And then maintain the airway and loosen clothing. Why do we want to loosen the clothing? They can choke. It's restrictive. Should we hold a patient down having a seizure?
No.
What?
Because you can hurt them.
If somebody was to fall on the floor having a seizure, Move the chairs, move the tables, give them space, because it prevents injury. And that's very, and that's good to know. Nursing care, it's important, documentation. Once again, the time, the dates, how long did it last, and describe the seizure. And then we want to know sequences that were leading up. Was he just laying there doing nothing? Or was he doing an activity? And then put your observations that he was just sitting there, all of a sudden he just eyes rolled back, started playing his arms, started screaming. This lasted 2 minutes and then slowly came down and was out. And after seizures, don't be surprised if your patient's out of it for a while. Get your set of vitals, monitor them, watch them, because they're going to be exhausted after this. This just takes a toll on the body. Okay? Cyanosis may occur, and it can be very normal. That's why when you have a patient who's in seizure precautions, you always want suction available and you want O2 available. Sometimes you can put a nasal cannula on a patient having a seizure, get it on without restraining them. But it is very normal to be fluid. F, it is prolonged over 5 minutes or repeated over 30 minutes as status ellipticus, you're in a medical emergency now. That's not a good thing going on. And once again, side effects, sedation. Some medications may depress the respiratory system, but also we know a lot of medications are very hard on our liver, and hence lab testing, keeping up with levels. Any questions on seizures? Yeah.
For EEG, is that the same thing as a grid? Or what's the difference?
I'm not sure. It could be the same thing.
Okay.
It's like EKG and ECGs, same thing. Just depends on what word. I haven't heard that. Yeah, they put the hat on with all the electrodes and they. Then it's the same.
Okay.
Now we're talking meningitis. It's an inflammation in the meninges that surround the brain and spinal cord. Your assessment, person's going to have fever and... Yes, sorry.
On that seizure, what book was the chart in? Is that chart in this book?
It's in your, look at your med-cert book. Iggy book. I got all this from Iggy.
And you're saying if they have cyanosis, that's just normal?
It can be very normal, but you want to make sure that get some O2 on them. Don't let them go completely blue, that we then have an additional problem besides just a seizure. You sit back, you monitor them, you watch them, you intervene if you can, and then afterwards. So with assessments with meningitis, fevers and chills, headache, they're going to have mental status change. Why is that? The inflammation in the brain is it's going to cause. They might have decreased or complete loss of consciousness. Light's going to affect them. They're going to have nausea and vomiting. They can have increased cranial pressure and they can have seizures with it. There's 2 different types of meningitis. Are you guys familiar?
The viral or bacterial?
Which one's the worst? Bacterial. Bacterial is going to be your worst form of meningitis. Labs. This is where you're going to do, they're going to take some cerebral spinal fluid from them to run diagnostic tests on it to see if there's an infection in it. They're going to do a CBC with differential. Why do they want a CBC?
White blood cells.
Complete blood count. They want to look at the white blood cells and see what's going on. A CMP, which is a complete metabolic panel. Why do you think we're looking at that?
Because there's vomiting and stuff.
How about electrolytes? If your electrolytes are out of whack and your CBC is out of whack, it's telling us something's going on. So we're looking at blood, and we want the CMP is a great way to look at your electrolytes. You get your sodium, you get your potassium, you get your calcium, you get your protein. You also get glucose. And then once again, CT or MRI. Nursing care and management. Follow the ABCs. What are our ABCs? Your vital signs could be Q hour, Q 2 hours, Q 4 hours. Why do you think it's important that we do this every 2 to 4 hours, vital signs and neuro checks on meningitis? That's our preventive. We want to catch those changes early. And if it's swelling, it's going to give us an idea how bad it's getting. Or if we've kind of got it. Why manage pain?
That could increase pressure.
Huh?
It could increase natural pain pressure.
Absolutely. Let's keep the pain. Antibiotic therapy. Let's start fighting this infection that's going on. And why standard isolation precautions or droplet precautions? With meningitis. If it's bacterial, what you need to find out is if a person comes in the ER and we find out they have bacterial meningitis, you start seeing people run, don't you? You start seeing them gown up. But then the other key factor with the bacterial, who have they been around? Because they now need to come in and get tested. And a lot of times this happens on college campuses and dorms. So it can be spread very easily, very fast. And we want to stay on top of it. Viral is just something, it's easily recovered from viral than it is bacterial.
Why is that? Because like you can treat bacterial, but you can't necessarily treat viral.
You can, but sometimes bacterial is such an aggressive form and it just hits everywhere so fast. Some doctors don't get on top of it fast enough.
Like does viral show symptoms like earlier or something? Like
Not really, but viral just doesn't seem to be as aggressive. You have a higher death rate with bacterial than you do viral.
Is that just because we don't know at first what we're looking for
Correct.
when they present?
Correct. And sometimes that bacteria, think about it, bacteria in your spinal cord and brain.
Yeah.
You know, 2 worse spots you can get an infection. I'd rather have an infection anywhere on my body than get my cerebral spinal fluid. So, okay, last but not least, Alzheimer's disease, a chronic progressive degenerative disease that is manifested by memory loss, judgment, visual precipitation, and changes in personality. That's another word some people say with Alzheimer's. Dementia, correct. You see this in older people, but some young people have been diagnosed. But usually you're going to see it 65 or older. Their cognitive decline, they get personality changes. What kind of personality changes do you think they might come up with? Huh? They are agitated, angry. They're angry all the time. And that could be they don't understand what's going on. Able to perform ADLs. You will start seeing changes of they can't dress. They forget their medications. Basic hygiene. But how about feeding themselves? They forget all that. Another good one, it's hard for them to manage money and responsibility. They just think that they can spend and have no responsibilities for anything else. And once again, another good chart, 4412 gives you a thing. Also the duration and progression. Alzheimer's has many stages. You have an early stage, and they have some medications that can help you with it. And then once you get to the late stages, you're pretty much to the point. Those people are usually in a facility, and it's a lockdown facility. And you just try to make their lives as best as you can. Once again, we're going to do some labs. We're going to do a CBC. We're going to check electrolytes again. Why is that?
We're worried about not getting enough nutrition and hydration.
Exactly. And by doing these tests, it'll tell you how this is. Once again, you got CT, MRIs, and EEGs to see how that brain is functioning. But the other main thing with the blood work with these patients is you want to rule out everything else. You want to make sure they might have an infection that's causing this. It's not so much the Alzheimer's disease that's causing it. Key things to prevent injury, I think is the main thing that you should look at with Alzheimer's patient. Install safety devices indoors. Why do we want to do that? Key thing, they wander out. So they recommend putting deadbolts Also, you're almost going to the point when you have a little kid at home and you put the safety devices on your cabinets, and then you put it on your oven so they don't open it. You're kind of going back to that stage too with Alzheimer's. You've read stories that they put something on the stove and left it. They're forgetful, they don't remember, they've got very short term. Minimize the clutter in the house. Make furniture, give large room. Remove rugs off the floor. Why is that?
So we don't fall.
Exactly. So not only do you have Alzheimer's, but then they trip on a rug, you've now got a broken hip. Night lights, keep well lit. You know, if they're going to get up and wander, you know, at least keep the hallways lit. And then alarm systems. They recommend you put it on doors and windows, so if it is open, you are alerted to the fact of what's going on. Chronic confusion, they're going to have, they want structure and consistency. You will find with elderly people, as you take care of them, they brush their teeth at 8, they eat at 8:30, they take their meds at 9, they go to the bathroom at 9:15. You know, they're on a regimen. As they get Alzheimer's, they get even more strict. But by sticking to the strict regimen, it keeps them calm. This is what they're used to, this is what they know. And it's a good thing. Reorient the patient, but do not confront them. Why don't you want to confront them?
Because they get agitated.
And they can get violent. So if your patient comes up to you and says, I didn't get breakfast today, how would you answer that? When you saw them sitting there eating their breakfast tray an hour ago.
Get them something.
Hey, how about I make you some toast? Let me go see if I can find something to eat. Even though you know full well, look, you were just eating there an hour ago. What do you mean? Don't do that because they don't realize that.
Isn't that more so like the later stages?
Yes. Yes. Stick to the routine. Stick to, you know, the other good one is distract and divert patients. If they're getting agitated about something and they can't find something, try to redirect their thinking. You know? Orange class, how about cards, colors? Hey, why don't you come with me? Hey, I've got this neat art project over here you want to help me with? You know, I had a patient one time and I would give him a stack of Orange class to fold. And I was doing it every hour because he would get agitated. I'm like, hey, would you help me fold these Orange class? And be the exact same stack. You know, but I took it out of the room, destroyed it, and that. It calmed him down. And that's the key thing. That's the key thing in safety to work with these patients is to keep them calm. Okay, management at home. Let's say you take them home and they're kind of in their early stages. Let's look at handrails, especially in the bathroom, by the toilet and the shower. It's a safety factor because they slip and they can hit. Their medications. How about therapy? What kind of therapy would I want to bring to my house to help me out? Home health. Get OT in to help them dress. Work with them. And PT might help too. Watch your hazardous appliances and secure them. That's your oven. You know, that if you have a gas oven, take the knobs off and hide the knobs. That they can't turn the burner on without igniting it. You know, safety factors. Also, here's a good one. Your electrical sockets covered, just like when you have kids, cover them. Because they can do the same thing your child will do, stick their finger in it. And a key thing, look at this chart, 4415. As a caregiver, taking care of an elderly person with Alzheimer's, it is a highly, highly stressful. Take time out for yourself. You have to maintain your life. There are respite areas, there's adult care centers, daycare, you've heard them. Try to get your loved one into that you get a break at least once a week. Have somebody else come in that's calm and they're comfortable with, that gives you that break because you've got to stay de-stressed because this is going to stress you out taking care of. And you know, if you've ever had anyone in the hospital or you've seen family members in the hospital with a loved one ill, you can just see, why not physically but emotionally, they're wrecks. Any questions? Nothing? All right, I got a little project for you guys. How about a little learning activity? Wake you up. We can break into groups for this. Let's take about 10-15 minutes. Does anyone need to step out for a minute? Get in groups of 3, 4, whatever you guys would like to do. We're gonna work on a little case study.
You're so nice.
They got one.
Probably just shove it for you.
Oh, yeah.
And I'll run.
There you go. Take one, pass it
So
down.
it's like the same summary test, but
I just have to be
yeah. So I like.
So you would take one and pass it down, please.
So you don't have a quiz for this one, so it's the same, right?
There you go. Take one and pass it down, please.